Prescription. Prescription is a written order from a registered medical practitioner or other properly licensed practitioners, such as dentist, veterinarian, to a pharmacist to compound and dispense a specific medication for the patient. The order is accompanied by directions for the pharmacist to prepare a specific type and quantity of preparation for a patient. The prescription also include the directions for the patient regarding the mode of administration of drugs which is dispensed for him. Thus, prescription is a media through which treatment is provided for a patient by the combined skill and services of both the physician and the pharmacist. The prescriptions are generally written in the English language, but Latin words or abbreviations are frequently used in order to save time. So it becomes necessary for a pharmacist to become familiar with the common Latin terms and abbreviations used by the prescriber while writing the prescription. Parts of prescription. Prescriptions are generally written on a typical format which are usually kept as pads. A typical prescription consists of following parts: date, name, age, sex and address of the patient, superscription, inscription, subscription, signature, renewal instructions, signature, address, and registration number of the prescriber. Commade LA BBE. 8. Date. It helps a pharmacist to find out the date of prescribing and date of presentation for filling the prescription. The prescription which prescribe narcotic or other habit-forming drugs must bear the though date so as to avoid the misuse of prescription if it is presented by the patient a number of times for dispensing. Though name, age, sex and address of the patient. Name, age, sex and address of the patient must be written in the prescription because it serves to identify the prescription. In case if any of these information is missing in the prescription, the same may be included by the pharmacist after proper inquiry from the patient. Age and sex of the patient, especially in case of children, help the pharmacist to check the prescribed dose of medication. In some cases, the weight of the patient may also be required in order to calculate the appropriate dose. 13. Superscription. It is represented by a symbol G which is written before writing the prescription. R is an abbreviation of the Latin word recipe, meaning you take thou. In olden days, the symbol was considered to be originated from the sign of Jupiter, god of healing. This symbol was employed by the ancient in requesting God for the quick recovery of the patient. Char. Inscription. This is the main part of the prescription order, contains the names and quantities of the prescribed ingredients. The names of ingredients are generally written in English language, but common abbreviation used can be written both in English and Latin languages. The name of each ingredient is written on a separate line along with its quantity. In complex prescriptions containing several ingredients, the inscription is divided into following parts. 2. Base, the active medicaments which are intended to produce the therapeutic effect. B. Adjuvant, it is included either to enhance the action of medicament or to improve the palatability of the preparation. C. Vehicle, it is included in the prescription either to dissolve the solid ingredients or to increase the volume of the preparation. Nowadays, the majority of the drugs are prescribed which are already in a suitable formulation. The pharmacist is required to dispense the ready-made form of drugs. So compounding of prescription is almost eliminated. 5. Subscription. This comprises direction to the pharmacist for preparing the prescription and number of doses to be dispensed. These days, the prescribers are omitting the specific instructions to the pharmacist because the majority of the prescriptions are not compounded and dispensed. Chair. Signature. This consists of the direction to be given to the patient regarding the administration of the drug. It is usually written as scanned by cam scanner. CH prescription 3. Sig on the prescription. The instructions given in the prescription are required to be transferred to the label of the container in which the medicament is to be dispensed so that the patient can follow it. The instruction may include the following. A. The quantity to be taken. B. The frequency of administration or application. C. The mode of administration. D. The special instructions such as dilution direction. 7. Renewal instructions, the prescriber indicate on every prescription order whether it may be renewed and if so, how many times. It is very important, particularly in the prescription containing the narcotic and other habit-forming drugs to prevent its misuse. Art. Signature, address or registration number of the prescriber. The prescription must bear the signature of the prescriber, along with its registration number and address. It is very important, particularly in the prescription containing the narcotic and other habit-forming drugs, to prevent its misuse. An example of a typical prescription is given below.